Have you ever been right in the middle of your day and felt a sudden, odd heaviness in your chest? Or maybe an unexplained wave of pure exhaustion? Most of us do the exact same thing when this happens. We instantly rationalize it. We blame a bad night's sleep, a stressful week at work, or just being slightly out of shape. But your body rarely fails without warning. Long before a major medical event, it continuously broadcasts data about its internal state. The real danger lies in our deeply ingrained habit of muting those signals. We consistently train ourselves to ignore the discomfort until the symptoms escalate into an emergency. Protecting your long-term health requires breaking that cycle. You have to learn how to translate your body's quiet, everyday whispers into actionable intelligence. Some of the clearest indicators of a struggling heart actually appear far away from your chest. Take unusual fatigue. You might wake up feeling completely drained after a full 8 hours of rest, and easily write it off as the side effect of a busy schedule. Biologically, your entire system is being starved of energy. When a weakening heart struggles to pump, it fails to deliver enough oxygen-rich blood to your cells, causing a systemic drop in stamina. Then there is sudden lightheadedness. It is incredibly common to brush off a dizzy spell as standing up too fast or skipping breakfast. However, if you experience chronic dizziness, it indicates poor cardiac output. Your heart is periodically failing to push adequate blood flow up to your brain. You might also notice swelling in your legs, feet, or ankles. Again, this is a symptom people easily blame on bad shoes or standing on their feet all day. This diagram shows the mechanics of edema. When pumping efficiency drops, it creates a circulatory traffic jam. Fluid backs up. Because the central pump lacks pressure to pull it back up, gravity takes over. Excess fluid pools in your lowest extremities. When the heart loses its mechanical power, your feet, ankles, and brain are often the first regions to suffer the consequences of compromised circulation. Other signals manifest right at the core, directly in your chest cavity and respiratory system. You might find yourself out of breath from walking up a single flight of stairs, or struggling for air while simply lying down. It is tempting to conclude that you just need to start working out again. This chart visualizes the tight dependency between your heart and lungs. A weak pump creates a bottleneck right here in the exchange loop, leaving your lungs physically unable to distribute oxygen properly. You may also feel your heart skip a beat or start racing for no clear reason. It is a sensation frequently written off as mild anxiety or too much caffeine. But an intense or frequent fluttering heartbeat points to potential instability in your heart's underlying electrical rhythm. Then there is radiating pain, a mild, spreading discomfort in your left arm, jaw, neck, or back perfectly mimics a pulled muscle or sleeping in a strange position. And of course, unusual chest discomfort, a heavy sensation, pressure, or tightness, especially during periods of stress, means the heart muscle itself is struggling to secure enough oxygen. Because these core symptoms look exactly like everyday aches, stress, or lack of fitness, they form a perfect camouflage. They convince you to delay action when you need it most. Experiencing one of these signs isolated and infrequently might be completely harmless, but a repeating pattern of multiple symptoms is a definitive alarm. These physical warnings shouldn't cause panic. They are a crucial window of time your body is giving you to intervene before a failure occurs. Supporting your cardiovascular system requires foundational maintenance, eating nutrient-dense foods, increasing your daily physical movement, and giving your body adequate rest. It also means prioritizing a professional medical evaluation. You do not want to wait for a subtle ache to escalate into sharp, undeniable pain. Your body's warning signs are quiet, but the consequences of ignoring them are absolute. Paying attention to those everyday signals is the most effective tool you have to protect your heart.